Ladies, if you're over 65, there's something critical that no one is warning you about, and it could be silently hurting your health. It's not your medications. It's not a hidden condition. It's the way you talk during your doctor's appointments. Over the years, I've seen countless intelligent, kind, and strong older women unintentionally make their medical care more difficult, simply because of how they communicate. That's why, in this video, I'm breaking down 7 of the most common communication mistakes women over 65 make at the doctor's office and how to fix each one. Stick with me to the end because mistake number 7 is something even the most health-conscious women tend to overlook. And don't forget to like the video, subscribe, and let me know in the comments. Have you ever walked out of a doctor's office feeling like you weren't truly heard? 1. Speaking too gently and not getting taken seriously. Many older women speak to doctors with such warmth, patience, and respect that you'd think they were trying to earn a gold star for being the good patient. But here's the truth. Being overly polite in a medical setting can actually work against you. When you say things like, "It's probably nothing, I didn't want to bother you," your doctor might subconsciously take you at your word and treat your concern as a low priority. We're not just listening to your words, we're picking up on your tone, urgency, and energy. And unfortunately, I've seen many probably nothing comments turn into something serious. Chronic fatigue that turns out to be undiagnosed diabetes, or a minor cough that ends up being early-stage lung disease. You don't need to be rude or demanding, but you do need to speak with purpose. Try saying, "I've had this issue for 2 weeks, and I need to understand what's causing it." That level of directness tells your doctor that you value your body, your time, and your health, and they should too. 2. Giving vague descriptions that confuse your doctor. Sometimes patients walk in and say, "I just don't feel like myself lately." I understand where that comes from. Maybe you're not quite sure what's wrong yet. But phrases like that are far too open-ended for a doctor to work with. A woman once came to see me and used those exact words. When I gently asked for more details, she paused and said, "I don't know, just off." That could mean a dozen things: dizziness, anxiety, blood pressure issues, memory loss, even early signs of neurological changes. After some conversation, she shared that she'd been experiencing lightheadedness in the mornings and had started forgetting little things like her keys. Those were major clues, and it turned out she was experiencing side effects from her medication as well as early vascular cognitive decline. If she had kept it vague, we might have brushed it off. So here's what helps. Before your appointment, write down what you're feeling when it started, how often it happens, what makes it better or worse, and how it impacts your daily life. Those details are like gold for your doctor, and they can make all the difference between getting brushed off and getting real answers. 3. Assuming symptoms are just old age. One of the most dangerous habits I see is patients dismissing their own warning signs with, "I figured it's just my age." Aging does bring changes, but that doesn't mean you should ignore new or uncomfortable symptoms. It's true that stiffness, changes in sleep, or slower digestion can be part of getting older. But things like chest pressure, sudden fatigue, blurred vision, unexplained weight loss, mood swings, or balance problems are not things to write off. Just because something is common doesn't mean it's normal. I had one patient who felt tightness in her chest for months. It wasn't sharp or intense, so she assumed it was heartburn or arthritis. But when she finally brought it up, tests showed a partially blocked artery, one step away from a serious heart attack. Please, don't minimize what your body is trying to tell you. If something feels off, speak up, because the sooner we catch a problem, the easier it is to treat. 4. Downplaying pain to avoid seeming dramatic. There's an invisible pressure on older women to stay easy and not make a fuss. I see it all the time. Patients show up with real, sometimes severe symptoms and package them in modesty. "It's not that bad," or "I'm sure others have it worse." But here's what's really happening. You're protecting your doctor from discomfort at the expense of your own well-being. You're trying not to take up too much space. And that's heartbreaking. One woman came in complaining of mild stomach pain. She rated it a 4 out of 10. But her body language told another story. She was pale, tense, and wincing. After I gently pressed for the truth, she admitted she'd been in intense pain for days, but didn't want to overreact. The diagnosis? Acute diverticulitis that required hospitalization. Minimizing your pain doesn't make you strong. It makes it harder for us to help you. Be honest. If it hurts at night, say it. If it's affecting your appetite, say it. If it's making you feel anxious or depressed, say that too. You deserve full care, and full care starts with full honesty. 5. Letting someone else speak for you. Bringing a loved one to a medical appointment is often a great idea. They can support you, ask questions you may forget, and help you feel more comfortable. But problems arise when that loved one starts doing all the talking. I remember one visit clearly. A daughter brought her 75-year-old mother, who was mentally sharp and capable. But before her mother could say a word, the daughter answered every question. I finally turned to the mother and asked, "Do you agree with that?" She smiled gently and said, "Well, it actually started a month ago, and I blacked out once." That detail completely changed the picture. When others speak for you, they may misrepresent your symptoms, skip over emotional context, or forget important events. Worse, once the doctor starts talking only to your companion, you can become invisible in your own care. Unless you're unable to speak for yourself, your voice should lead the conversation. If someone interrupts, it's okay to say, "Actually, I'd like to explain that myself." It's your body, your story. No one can tell it better than you. 6. Leaving confused because you didn't ask for clarification. Doctors are notorious for speaking in fast, technical language. Not because we don't care, but because we're trained to use medical terms, and sometimes we forget they sound like a foreign language. Sadly, many women feel uncomfortable asking for clarification. They smile and nod, even when they're completely lost. One patient of mine left an appointment thinking moderate stenosis meant she had cancer. She lived in fear for 2 weeks, when all it meant was a non-cancerous spinal issue. You have every right to say, "Can you explain that in plain English?" Ask questions like, "What does that word mean? Is this something serious? What happens next? Will this affect my day-to-day life?" Doctors are here to serve you, not the other way around. The more informed you are, the better your outcomes. So speak up until it makes sense. 7. Not using notes and forgetting important details. This last point is incredibly common and totally avoidable. If you walk into a medical appointment without notes or leave without written instructions, you're putting yourself at a disadvantage, and it's not your fault. The brain just doesn't retain everything under stress. I once spent 30 minutes with a patient discussing her mild heart failure, how to monitor fluids, limit salt, weigh herself daily. She nodded and said she understood. 2 weeks later, she was back, swollen and confused. "You wanted me to weigh myself every day?" she asked. She simply forgot, and that forgetfulness nearly put her in the hospital. So here's what to do. Before your visit, jot down all your symptoms, questions, any medication changes, or concerns. During the appointment, take notes or ask the doctor to write them down for you. You can even bring a notebook and ask your companion to write while you talk. Then keep those notes in one place and bring them to your next visit. Your health is an ongoing story, and without notes, you're asking your memory to do more than it's capable of. Final thoughts. You deserve to be heard, respected, and well cared for. And the way you communicate during your appointments can make a huge difference. So next time you're sitting across from your doctor, remember, your voice matters. Your story matters. And no one can advocate for your health better than you can.